Let me show you how to be a good busy and change your predictions.
Yes, one of these questions that I have for you is, especially during COVID, Bayesian modeling became a crucial tool. I remember I did some work at my very low level at that time, but you did a bunch of work on that. And as you were saying, I imagine there were a lot of very short nights and very long weeks. Can you share specific example of how these models were able to inform public health decisions?
Yeah, so I think there's quite a few instances, particularly around scenarios, where models can be a very useful kind of decision support tool. Because essentially, if you're going to make a decision about what to do in an epidemic, everyone has a model in their head. Because if you think, let's do this, let's try this, you're making some assumptions about what you think is going to happen. You're making some assumptions about how you think epidemics work. So models are a very nice way of allowing us to really write down and formalize what we think those processes are and what we think the intervention is going to do. And then we can debate whether that's reasonable, whether that's not, so we can see if that generates any counterintuitive effects. But in doing that, you really want to capture the extent of information you have about the problem you're dealing with. So even, for example, the question of how much effort is it going to take to get transmission down? Well, one of the key things that is going to influence that is how much transmission there really is. So a lot of the analysis that we did, being able to pass around uncertainty was really important. So very early in the pandemic, for instance, because we were relying on quite uncertain data from China, quite uncertain data about exported cases, we had some sense of what transmission would do in a country without any control measures, but there was quite a large amount of uncertainty on that, probably reproduction number somewhere between 2 and 4. And so what we wanted to do is when we generate UK scenarios to present them, we didn't want to give one number. We wanted to say, look, we don't know actually if it's more at the upper end or lower end of this, but we want to kind of define that uncertainty in what we simulate. And then after that wave comes through, we had lockdowns like many other countries. There was this push to reopen. And then the question is, okay, so we've had that wave, what's the reopening going to look like? And again, that's where these kind of Bayesian methods can be very helpful, because we can take the uncertainty and perhaps we've got more confidence now about what we're dealing with, but then we want to pass that level of confidence into what's going on in the future. And then, as variants started emerging, that became even more important, because often for alpha, we would have some degree of confidence about how much more transmissible it was, how much more severe it was. And in any analysis, for example, we did a lot of work early in 2021 of how quickly you're going to have to vaccinate. And I think there's a lot of pressure to lift lockdown and trying to understand that trade-off. If you're vaccinating at this rate and you're lifting lockdown this quickly, what's that going to look like? And again, none of those values you had very precisely, and you had more epidemic data coming in all the time. And as particularly that process of reopening in 2021, there was that very tight relationship between models and policy, because in the UK, it was one of the few times where the policy was actually very informed by what was useful from a technical point of view. So what they did was they had these series of steps in the roadmap, and it was designed to give enough signal in the data post each step that if something was going very wrong, they wouldn't have implemented another step before you had that signal. So they were kind of deliberately spaced out so the models and the epidemiologists would have enough time to work out what that relaxation had done. So again, from a kind of Bayesian point of view, that's really nice, because it gives you enough time to kind of update your posterior sensibly before you do the next step and work out what effect that's going to have.
Right. Yeah. Okay. That's fascinating. I didn't know there was that level of coordination where you could actually do that.
I think there were many examples where it didn't work in such a coordinated fashion, but I think that roadmap reopening was one where there was a much tighter relationship between the questions coming down from policy and what models needed to say something sensible about the implications.
Yeah, and I guess I'm also wondering, how much do you think the pendulum has swung back from then? Do you think we'll be faster to implement these workflows and improve them next time there is a pandemic, or will we have to work from a blank slate because politics is so short-sighted with very short, cycles?
Yeah, I think that's a really good question. I think there's some things that have been positive in terms of progress. So I think in terms of what we're doing and others in consolidating a lot of the tools that are available. So some things now that we, looking at quick questions at H5N1, questions that I just wouldn't have bothered doing previously just as a curiosity, because it would have been 3-4 hours just for a maybe question. And now in 20 minutes, you can get a rough example. So I think that's quite nice. It's bringing things into reach. But I think in terms of just staff capacity and people to do this work, I think there are a lot of people who, put a huge amount of time in, often as around the world, getting pulled off different roles and off other projects. And so I think in a way, in that sense, we probably don't have the same workforce who could undergo that amount of pressure for that amount of time. So in a way that creates the necessity of we need to get better tools, because we don't have, I think, that volume of people, but also just, all our projects. So we basically took people off a lot of other funded projects. And I think we wouldn't have the resource to do that in the same way now. So for me, I think particularly what we're interested in at the moment is if you imagine the set of tasks that you might have to do in an epidemic, some are tasks that a lot of other people have to do, and we can really predict ahead of time you're going to need to do that. So stuff like working out the severity of infection or working out the transmission, we know we're going to need that done. We know that lots of people are going to do that. So that's a really good task for automation and getting really leading edge, Bayesian methods standardized so everyone can do that, and we don't all have to duplicate effort. There's other things that could be really specific. Maybe within a country, there's a kind of subgroup that's particularly important, or there's a certain variant or something you might want to deal with. And that's going to require more domain knowledge. And I think at the moment, even if you talk to people at different, outbreak organizations around the world, they probably spend 60 or 70% of their time on quite low level, predictable, data wrangling type questions, rather than the sort of 30% of expertise led questions they'd want. And I don't necessarily think in a pandemic people would end up working less hard because everyone wants to contribute as much as they can. But I think what I'd like to see is a lot more time on that 30% and going much deeper into what we can understand, rather than spending a lot of time, even just trying to get a sense of the data and the basic tasks to answer very simple questions.
Yeah, that makes sense. Not sure I'm really reassured by that answer, but yeah. That's absolutely the realistic answer. Something I'm also really curious about because I see that a lot as a modeler myself, is where the common misconceptions that you've seen the public or elected officials or even professionals have about epidemiological data, and what the scientific community can do to clarify these misunderstandings?
Yeah, I think that's a really good question. I think one common misconception is even just what data are as a thing. I think often when people talk about raw data, they're talking about inferred estimates. So I think one example of this is excess deaths that I think the media often treat as a measured thing rather than actually a counterfactual. And I remember talking to journalists about the comparison with flu, and I think a lot of them discovered that the flu mortality statistics they've used every year actually involve some quite big modeling assumptions about seasonal patterns behind them, and there isn't just this magic number that we measure.
Right.
I think similarly with a lot of the estimates, for example, in the UK, they ran randomized testing surveys. So they randomly tested people in the community each week and reported it. And that number, that wasn't a raw proportion, because of course you needed to do some standardization across groups and weighting. And in some cases, because it was quite noisy across multiple panels, they would have, a kind of smooth underlying proportion and then infer that. So it was sensible modeling, but there was modeling behind that. And I think the misconception often is that these things are raw data, but often, even a very simple thing, if you calculate, if you run a survey and calculate a proportion, you're making some modeling assumptions. Or if we're going to adjust for age. Well, why are you adjusting for age? Why are you not adjusting for something else? You're making assumptions about what you think are important drivers of that thing you're measuring. So I think that's probably one thing we can get better at communicating, is that actually this distinction between models and data isn't that simple, that a lot of things we think are data are actually modeled estimates. And actually a lot of the things that sometimes people treat as super complex models are actually just quite straight, simple steps for thinking about data. So even one of, if you've got a bunch of hospitalizations over time and you want to know when the infections happened, you can use quite simple, like a deconvolution model, just to take that and work out when the infections are. And I think often in public perception, when people talk about models, what they mean is very complicated scenario models that people are assuming are used to make forecasts. So I think it's often the kind of a crystal ball. I've used this big complex model to say what's going to happen. And I think in reality, what happens is that often the more complex models are used for scenarios and like what if, because we can't make forecasts often in pandemics as well, because you'll be forecasting what policymakers are going to do. And if your models are used as tools to support their decisions, it becomes quite odd to use that as a forecast. I mean, I think the example I sometimes give is like, imagine you're playing a game of poker, and at any point in time, you want to understand the implications of your decisions. What you don't really want is someone on your shoulder saying, I bet you're going to fold later this round. What you want is someone who can say, look, if you raise, this is likely the situation you're going to face. This is the risk you're taking on. If you fold, this is potentially what the outcomes are going to be. So that's really how a lot of these models are used in kind of decision support. But I think in public consciousness, they're often seen as we're saying this is going to happen in the future. And I think part of it is communication, and particularly those simple. I think getting people to be able to play with those simpler models can be very helpful. So they realize it's not this super complex thing. It's probably what they're doing in their head, but just writing it down in a bit more of a structured way.
Yeah. I find also, indeed, walking through scenarios is something that's really helpful to people, because, well, they can imagine the scenarios, and that's much more, tangible and concrete than numbers and posterior distributions. I can see that a lot. I mean, sports is a lot like that, especially baseball. Lots of different discrete scenarios.
Yeah, and I think often people, particularly with epidemics, are kind of doing it in their head all the time. That so the epidemic's going up, and you say there's going to be a problem, and then you get a few data points that seem to be tailing off a bit, and basically everyone's doing that updating in their head of where they think it's going. But they often, I would have loved to have seen more politicians and journalists actually write down you could get them to actually just write down their prediction and their kind of distribution of what they think is going to happen, and then see how there's update, and then you could actually give them a better understanding of what's going on in their head relative to actually what's plausible given the data that's coming in.
Yeah, but so I completely agree with that, and I really love that. But I think here the incentives are really bad for politicians, right? Because then if you publicly, privately, I think that's
do that a lot. But I think that's a really good point. Yeah. I think that's a really good point. Yeah, I think getting politicians to write down what they think is going to happen publicly is very difficult. But I think even privately, I think there were a lot of people probably not doing that would. So amongst colleagues and stuff, we sometimes just had private email things of, when you think this study comes out, what do you think it's going to show? And I think it's sometimes quite, we like to kid ourselves. So even if it's just writing it down for yourself, I think it's just quite useful to have that to reflect on.
Oh yeah, no, I'm like completely on board in helping people develop a more probabilistic thinking. I think you doing the work you're doing, and also the communication work you're doing, is very important. All your books. That's also why I have this podcast. People like Nate Silver and writing books is very important too. Like, I don't know if you read his last book, On the Edge, but that's very important too for that, right? And I think that'd be awesome if we we're gearing towards that direction. But yeah, the problem is like the public incentives in politics are so bad when it comes to that you actually have a much better standing if you just, say anything and everything and just are not held accountable for that than actually, betting on something that would happen and then changing course if actually what you said would happen did not. And then,
Yeah, and I think partly from the communication, but there's also what are the things that we can do meaningfully, and what are the things that you can encourage people to do versus just what's feasible. And I think also just from a kind of modeling point of view, sometimes there's this idea that for political decisions, you should have this big model with absolutely everything in and all the kind of the weights of how you do everything. And I mean, I can't see any political party wanting to do it because ultimately those things are going to be weighed, not in a kind of written down, we're going to put 10% on this and 15% on this. And so I think it's working out, where the science can be really informative and where actually there's more of that kind of human political element, and that, that's not the best battle to be fighting at this point.